Hi, I'm Dr. John Martin with Ivy Family Health Updates, and I'm here with my brother, Dr. Edward Martin, my sister, Dr. Catherine Martin, and our special guest, Dr. Manjula Jesgosothy. Dr. Jesgosothy is a graduate of Harvard University and the University of Pittsburgh Medical School. She did an internal medicine internship at Yale University, followed by a residency in dermatology at the University of Miami. She now practices here in Miami. She has a great practice. She speaks all over the world on a variety of different topics in dermatology, so we're very privileged to have Dr. J here with us today.
Thank you, Dr. Martin.
Great to have you.
Here.
And today we're going to talk a little bit about acne.
Okay, sounds
so
good.
just a little overview of what it is, how to treat it.
Sure. Acne is something that actually affects 90% of people at some point in their life. Generally, a lot of the people I see tend to be adult women who have it as a result of hormonal issues, which we can discuss in another segment. A lot of the other population is teenage kids, and a lot of that, again, has to do with hormonal causes, but it's much more easily treated. There are a lot of misconceptions. Everyone talks about acne. You know, why do you have it? Is it this? I ate so much chocolate. You know, last week I broke out, etc. You know, there were studies, a lot of studies done in the 70s just to see whether there was a direct link with what you ate and whether you broke out. And there were no direct links found with fatty foods, with chocolate, with anything like that. However, I think now the understanding is coming that it's more complex than that. I think the foods we eat certainly dictate our hormone levels and insulin levels. And so no matter what, I think if you feel like something is breaking you out, I tell patients, then avoid it. You know,
right.
it's
Sure.
an easy enough
Common
thing to
sense.
do.
Yeah.
Exactly. So now topical therapy is generally aimed at degreasing the face or reducing the oil gland production of oil or sebum. With that, we'll use salicylic acid washes or salicylic topical agents. Probably the most effective agent for inflammatory big red pimples are combination gels such as clindamycin with benzoyl peroxide, called Benzoclin, or maybe another one which is erythromycin with benzoyl peroxide.
So an antibiotic with a...
Exactly, in a topical,
okay.
nice gel.
Okay.
And you apply that directly to the spots. And that's a great treatment for the pimples you have. Now, it's commonly known also that what about the pimples that you're going to get? So the pimple starts with a clogged pore. So the way to deal with that is to use a retinoid agent, and that's in the class of medicines called retinoids like Retin A. Retin A is the prototype agent now. There are hundreds of medications that way. Even topical agent retinol is a derivative of that. And they're all vitamin A derivatives. And what they do is they actually physically unclog the pore. And that's applied to the whole area, affected area, once a day or so. And that'll prevent the new lesions. And for a good portion of certainly teenage patients, 70 to 80% of them, a good topical regimen is all they need.
Okay.
If they're still breaking out after that, they tend to be deeper cystic lesions. We treat them with oral antibiotics, which are used more for their anti-inflammatory effects than their antibiotic effects, meaning that it's not to kill the bacteria as much as to reduce the inflammation in the pimples, which will then drive the whole thing in a better cycle, in a more positive way. The gold standard of treating acne is a medicine that used to be called Accutane. It's now generic, so there's different names for it, but it's isotretinoin. And what that medicine does is it irreversibly shrivels the sebaceous gland in the pore, so that you never produce the kind of oil that you used to produce before. And so that basically permanently decreases the amount of acne an acne-prone patient would have had in their lifetime. There are a few patients who we will put on this medication who require a second course, and that's all sort of between you and your dermatologist. This medicine has a lot of side effects. It requires monthly laboratory testing and frequent pregnancy testing as well, because it can cause birth defects should you become pregnant while you're on it. So these are things, this is something that you should discuss with your dermatologist, but no matter what, there is not acne that we cannot treat, regardless of the way. In another segment, we'll discuss the hormonal aspects of acne, and certainly I think in adult women, I think birth control therapy, you'll agree with me, tends to be very effective.
Well, percentage of your teenage patients end up taking Accutane or the generic version?
I would say probably 10%. It's not high. I think early intervention again is a good idea. I think that if you see somebody who's pretty bad, has bad family history, it's better to treat them earlier rather than later. Just because later in their 20s and 30s, at the time when they're going to get married and try to think about starting to raise a family and that sort of thing, become pregnant. And so it's better to do it maybe when they're in their teens and that sort of thing is further away than closer.
I think it's also nice to help prevent the scarring.
Right.
Absolutely,
Right.
absolutely. Yeah. And scarring, I always tell my patients, scarring is so much harder to resolve than the acne itself. So it's much better and much more expensive. I mean, most insurance plans will cover your acne treatment, but they won't cover your acne scar treatment. So.
How about some of the new lasers that they're using to help with acne? Have you been?
Probably the one that's done that has the best clinical studies is called the Smooth Beam, and what it does is it basically is an anti-inflammatory. It's a beam that basically addresses the inflammation in the pimple, and they've shown it to have decent results, sort of on the line of taking oral antibiotics, but it is fairly expensive, and once you stop the treatments, the acne comes back. Something that I've found to be more effective and less expensive is something called blue light. It's a light of a certain wavelength. It's a blue wavelength that's geared towards the fluorescence in the bacteria that's in your pimple. It's the bacteria that's in your pimple is called P. acnes, Propionibacterium acnes. And basically this blue light kills it. And so a lot of dermatologists are incorporating this into their regular regimens with their teenage patients because it has no toxicity. It's basically just like, ambient lighting,
right,
except it's blue. You sit under it just like a tanning bed for 15 minutes once a month, and it's inexpensive.
No pain?
No pain, no nothing, and it really helps, and it's sort of as effective as antibiotics. So people who don't like to take pills, or people who are leery of taking pills for a long period of time, it's a good alternative. It's called the blue light.
To the antibiotics like the doxycyclines and the medicines, the anti-inflammatory properties are very important. Do they also kill the acne bacteria?
They do, but we don't think that's as important. So
Okay.
we think the lights have some anti-inflammatory effects as well.
Okay. Very good. So I think one of the main things though is, if your child has acne, really get them seen early.
Sure. And a lot of pediatricians are certainly equipped to deal with garden variety teenage acne as well.
Okay.
So it may not require another visit to a different specialist.
I just noticed, it's just managed so much better today. It distresses kids, and so it gets managed by their pediatricians, or they get to a dermatologist. And you don't see as many kids with severe acne nowadays.
Absolutely.
As when we were growing up. And it's a good thing.
Oh yeah, definitely. Because we see also the scarring down the road, and it's very, very hard to treat.
Absolutely.
So it's great if you can prevent that scarring from the get-go.
Absolutely.
All right. Well, very good.
Thank you.
Manjula, thanks for being here
Thanks
with
a
us.
lot.
And thank you.
Thank you so much.